I am showing the top of the hour, so we will go ahead and get started. This is Lynette Elliott. I would like to thank all of you for joining us this afternoon. It's October 24th, and we are still doing an end-to-end review on the food insecurity data set. And most of you who have been on this call have gone through these admin items with us before, but if you're new, please note that we do record these meetings and we do post them to Confluence following the meeting. So you have entered on mute so we can cut down on background noise. There will be times when we open up the floor for questions, and you are more than welcome to unmute yourselves. In the meantime, feel free to use the chat feature. We've had some really good chats on the chat feature because all of you are more than welcome to address questions that come up just like we are. So please please send it to everyone if you pose a question or a comment on the chat so that everyone can see it and we can all help answer your questions or address your comments. Next slide, please. If you have not already done so, please do join the Gravity Project. This is the list that we use to send out communications via email. So if you are not a joined member, you are probably not receiving emails from us. But you can go to the Confluence and join as either a committed member or an other interested party. And we have all levels of participation, and we appreciate all of you. Next slide, please. We will go through the data element submission status. Linda will present that. And then Donna will walk you through the end-to-end review for interventions. And then if there's time, interventions it's pretty robust. But if there's time, Lisa will walk you through part 3 of the FHIR IG development process. And then we'll go through next steps. Next slide, please. We have updated our schedule to accommodate additional time for all of you to submit comments on the food insecurity data set. We realize that we are rolling up on some holidays here and it's not going to get any less busy. So what we've done, you will see today we are going through the end-to-end review working session still, and we will do the same thing next week. And again, as time permits, Lisa is providing information as we ramp up to start work on the FHIR implementation guide as well. So today is the 24th, and then this next slide shows how we have adjusted the schedule. We will not start consensus voting on the 7th of November. We will actually be reviewing end-to-end comment dispositions that have been received to date. So if you have submitted comments thus far, you might hear some of your comments included in this conversation. But the deadline for submitting comments, we'll present this again at the end of the call, just as a reminder. But the deadline for submitting comments on all of the food insecurity data set segments will be, if I am correct, November 7th. And then that will give the internal team time to consolidate and make sense of all of those. And then the following week, on the 14th, we will review the consensus voting process. Some of you will be unfamiliar with this process, so we will walk you all through it so you know what to do and how to vote. And we will start consensus voting that Friday, the 15th of November. And you will be given until the 1st of December to submit your votes and your consensus voting comments. And again, we've done that because we realize there are holidays in here. It's going to get really busy. So we wanted to give you enough time to get your heads around what you're looking at and what you want to comment on and how you want to vote. So for the 21st meeting, we will most likely go through some details for the FHIR IG and how you can best participate in those activities and how you can support those and provide the input that we know all of you will be able to provide because you are experts in this arena, and that's why you're all here. And we so appreciate you. So then after that, there will be Thanksgiving. You will have a brief respite on the 5th of December. There will be no meeting that week because we internally will be reconciling all of the consensus votes and comments. And then on the 12th of December, we will present those results and the dispositions from consensus voting. And we will, Lisa will introduce the FHIR IG review process because this is what we'll start with. We'll ask you to start working on this basically from the middle of December to the beginning of the year, and then we'll continue work on the FHIR IG. As a note, the December 12th meeting is the last community meeting in 2019. So if please make sure that you're able to be on that meeting, because it'll be a basic wrap up for the end of the year, and then we will see you all in 2020 after that. Next slide, please. At this point, I will hand it off to Linda. Linda, you want to go ahead and share the data element submission status?
Yes, thanks, Lynette. Yes, on this slide, those of you who have been on previous calls are pretty familiar with this slide. One thing you will note is there's no more red. We have, in fact, finalized all of the submissions. We just are waiting to determine from your input the set of CPT codes we're going to provide for case and care management. Once we do that, all of the submissions will be completed. So we've returned 18 of the 19 submissions, and we'll do the 19th once we get through the case management CPT codes. And pretty much these statistics will be our final statistics for the food insecurity submission process. Next slide, please. Just a reminder of those dispositions on the previous side, what they are, their definition, and how, what they mean in terms of anybody who submitted a data element that has one of these adjudications on it. Next slide. And this will be turning it over to Donna, who will walk you through all of the intervention submissions.
Thank you, Linda. I really appreciate that. Everyone, welcome. Good afternoon. I'm really excited to share with you the information about the interventions that are included in the data set. So I'll be stepping through this interventions framework. We'll be spending some time talking about those individual interventions, giving you examples, and then also talking about some of the programs that are associated with interventions. For those of you who have joined us before, you know that few of the interventions to address the social determinants fit within existing medical terminologies. So we need to build a framework of how we care for social needs in order to have consistency and permit communications across settings. This is a new construct for social needs interventions, and it's an exciting part of this effort. The framework shown here is the most recent version developed with the input of the community and tries to account for the many settings and roles across clinics and communities. This was made possible because of the amazing work by my colleague, Sarah DeSilvi, on this framework, the very thoughtful input and submissions of multiple organizations who are here today, and the verbal and straw poll feedback of the Gravity community. SNOMED CT is the appropriate terminology for these interventions because it's the terminology used to describe non-laboratory procedures and actions. The definitions here for counseling and education borrow heavily from SNOMED CT. The others are a compilation of definitions from SNOMED, HL7, and the Agency for Healthcare Research and Quality. The programs that you'll see in the following slides are a combination of Gravity subject matter expert suggestions as well as those of the Gravity community. Before I close, I'll also be providing information about the programs associated with interventions and request input from this community about the definitions for these programs. Next slide, please. So right now I'll be stepping through a few examples of interventions based on the framework categories. These are just a few examples, and you'll find more detail in the summary file for interventions that will be provided to the community on the Confluence page. So under the concept of assessment, here are some of the examples that are included. You'll find the data elements of assessment for food insecurity, assessment of patient goals, and assessment of progress toward goals. Next slide, please. For the concept of coordination, we have items such as coordination of care plan, coordination of care team, and coordination of resources to address food insecurity. Next slide, please. In the framework, there is the concept of provision of, and some examples of items that would be included in the data set are proposed provision of food, provision of fresh fruit and vegetable voucher, and provision of infant formula prescription. Next slide, please. In the area of counseling, there are a number of concepts that are provided in response to the feedback from the community for counseling for barriers to and readiness for engagement and goal setting. These are consistent with the National Committee for Quality Assurance model regarding person-centered goals. There are also concepts for nutrition counseling that are from the Academy of Nutrition and Dietetics terminology. These support nutrition counseling interventions based on theoretical frameworks and strategies with the aim to identify the most effective nutrition counseling intervention strategies. Next slide, please. The concept of referral to has three overarching concepts. We find there are concepts related to referral to roles, such as case manager and care manager. There's referral to organizations, like a referral to a community action agency, or referral to programs, which I'm going to describe in a little bit more detail in a couple of minutes. Next slide, please. For the framework concept education, there are a number of items that fall under this umbrella. Some of the ones that are specific to nutrition include concepts like nutrition skills, where someone might be teaching someone how to cook, or it might be teaching knife skills. There could also be technical nutrition skills education to help clients interpret blood sugar readings and adjust the food that they are consuming based on those results, as well as concepts such as benefits enrollment trust education. All of these are included and proposed for the intervention data set. Next slide, please. There are 4 intervention types that apply to several programs that are very familiar to many of you who work with individuals who are food insecure. Programs such as senior congregate meals, the WIC program, the SNAP program, and home delivered meals are just a few examples of these types of programs. So 4 of these interventions from the framework would apply to these concepts. So we have education about these, referral to, evaluation of eligibility for, and assistance with application for any one of these types of programs included in the data set. Next slide, please. There are a number of CPT codes that have been proposed, and those often map to more than one intervention activity in the intervention framework. So you'll note when you review the intervention summary document that they have mappings to multiple intervention framework concepts. The parenthetical concepts or the parenthetical numbers listed here identify the number of CPT codes for each of these ideas. So, for example, for preventive medicine counseling and risk factor reduction, there are 6 CPT codes included in the data set. The case management concept here has an asterisk because it will include the CPT codes that are being recommended by this community as assigned by last week's homework. Next slide, please. I wanted to take a few minutes now to introduce you to something that we've been working on behind the scenes based on all of the programs and information that we received. This is not a concept that we have reviewed before, and it isn't something where you need to necessarily review the information here in depth. You will be provided with this as part of the intervention file. So you'll have ample opportunity to review all of the content here and provide feedback. But one of the things that we identified early in this work is it became evident that to address and review the subject matter expert submissions and the submissions from the community, that there should be a comprehensive list of identified programs that are used to meet the needs of those who are food insecure. The Academy of Nutrition and Dietetics agreed to take on the task to identify these programs. We enlisted the support and assistance of experts in public health nutrition and terminology standards to review the types of programs that might be used in this space. There were 3 recommendations that came out of this work. The first of which is that we would identify program concept labels that would be more general and would not be based on the current name of a federal program whenever possible. Now, in some cases, programs like, for example, Meals on Wheels already exists in SNOMED CT. So we made a decision and recommendation to continue to use that program name, and create a parent concept of home delivered meals where that particular program might reside. So whenever possible, we have tried to recommend more generic names and then identify programs that might exist within them. As you can see on this slide, we've drafted definitions for programs. Thankfully, not all of them are as lengthy as this one. Many of them are much shorter, but we draw on the actual program concept names that are, or program definitions that are already identified and have tried to distill down then a definition so that this program concept could be understandable and agreed upon by this community. If there are other programs that would be included in the concept, like the example that I gave you about Meals on Wheels being part of perhaps a broader concept of home delivered meals, those program names are identified. So in this situation, we have the Child and Adult Care Food Program with the proposed definition that you see here. Next slide, please. These concepts listed here include a broader program concept label, for example, Community Meal Program. It includes the concept of congregate meals, but it would also include many other programs such as community or religious-based kitchen or soup programs within this broader concept. The concept of food and nutrition incentive program would include these 2 named programs and would permit other programs to be developed or tried and tested over time and perhaps retired, but would live within this parent concept of food and nutrition incentive program without having to change the label in the data set. Next slide, please. Food pantry programs are well known. They can also be referred to, though, as food banks. So one name, food pantry, has been recommended with the definition that you see here. It would include the food distribution program on Indian reservations and school-based food pantry programs, for example. Food prescription programs would include not only prescriptions for food generally, but it could also include concepts such as produce prescription, which would include fruits and vegetables, or something more specific, such as just a vegetable prescription. Next slide, please. A food provision program, for example, would include food that's offered, such as groceries that are part of an educational opportunity, a commodity food program, or a food rescue or gleaning program, or a weekend food backpack program. Innovative programs like garden programs would also be included among our program options. Next slide, please. The mainstays of medically tailored meals and school and snack programs are defined as well, relying on the definitions associated with these very well-known programs. Next slide, please. Now, while I've said we've tried to create some more general concepts, some concepts are very well established, such as the Special Supplemental Nutrition Program for Women, Infants, and Children, or the WIC program. So this program concept label was maintained, but you can see here it also includes a more narrow program, the WIC Farmers Market program. The summer meal and snack program, for example, is distinct from the previously mentioned school meal and snack program, and they have their own separate definitions because these programs operate slightly differently. Next slide, please. The Supplemental Nutrition Assistance Program, federally known as SNAP, is very well familiar to everyone here, but it's not always labeled SNAP in each state. So we've chosen this particular program concept general names as the Supplemental Nutrition Assistance Program, and then it would accommodate all of the different named programs that are based in each of our states. Home delivered meals, again, is a general parent concept, and it would include a concept like Meals on Wheels, but this broader concept could also include many other types of home delivery meal programs. Next slide, please. So what are we going to be asking you to do? The kind of work that you have ahead is to download the interventions file, and you'll see within it 4 tabs. This is a picture of the summary view of the first tab. Included are all of the interventions summarized, and you can see them by type. In the far left-hand column is an identification number. When communicating with us with feedback about these concepts, referring to that identification number is extremely helpful so that we are sure to know your feedback regarding that particular concept. Next slide, please. The second tab that you'll see in the interventions file is a more detailed view. With all of this, it lists every single data element in this tab so that you can review them all. They are grouped again by concept. I couldn't get this to fit all on one slide because it would make the visuals so tiny, but to the right of each one of these, if there is a known concept within SNOMED, that mapping number is provided in this detail view. You will notice once you land on this tab, though, there are a number of gaps. And so these certainly, there's a lot of work to be done here. Next slide, please. The third tab is this interventions program summary idea. So here it lists all of the programs that I went through, some of the other programs that you did not see, but we refer to and that all of you submitted, and the individual cross-check to show which of the intervention framework ideas applies to those programs. So you can do that cross-check there. Finally, there is a fourth tab that has all of the programs and the proposed definitions that we provided so that you can take the time to go through each one of those and review them at your leisure and provide us with feedback about them. Next slide, please. So this gives you a summary of what we're asking you to do. The intervention file, along with the files from the previous 2 weeks, the screening file and the diagnosis and goals files, are on the Gravity page. Again, I mentioned the ID number. If there is a data element that is currently on the list and you do not agree that that element is appropriate for food insecurity, please put that ID number and let us know that you don't agree that that element should be part of that data set. If there are data elements that are not on any one of these files, you are welcome to submit that information, and please include a description for the data element that you propose. If you're submitting any screening elements, attaching a copy of the screening tool or the link to the screening tool is essential so that it can be evaluated for the project. For the program definitions, providing the name of the program and any recommended edits for the definition are welcome when you submit your comments regarding interventions. The interventions feedback we're requesting by November 7th, and we're thankful for all of your participation on these data elements. Does anyone have any questions? Looks like we've got a few.
Donna, there's one question, this is Lisa, that I could see buried back a little bit. Caroline asks, why not call it, we'll have to see which the it is, why not call it governmental nutrition benefit program in case the name changes again in the future?
Exactly. Yes, it's a really good point. So there are a number of concepts within this. There is actually a recommended kind of higher level concept or parent concept that we've proposed for these called the nutrition and food support programs as an overall kind of generic parent. But if you have suggestions for any of these programs to make them as generic as possible, but yet still understandable, that would be welcome feedback for the group.
I also this is Sarah. So part of the problem too is that we have to use language that doesn't cross purposes conceptually too. There's just so many government programs, and some of them have funding coming from federal points, and some of them have funding coming from state points, and sometimes it interacts. And so even with the Gus Schumacher Nutrition Incentive Program, they've had enough early kickback on that name, are now just shorting it, like they abbreviated it as the GusNIP. It's just too confusing to everybody. So I feel like it's possible we could consider another term, but the government thing is a little tricky just because SNAP is also a nutrition program coming from the government, as is WIC, and so it gets complicated. And so this is kind of why, again, all feedback is welcome, but this is kind of why we tried to settle on something that was as close as possible to the former name without crossing terms that we use in other settings.
And I would add to that, Sarah, that not all food support programs are government-based. A couple of the examples that I cited are programs that are done by other nonprofits that are not based in government. So we'd have to be careful about where it is we would place that concept if we did use one with a government label, where we would place it in the hierarchy. Okay, I'm looking to see if
I
there's
had
any.
one other notion to throw out there. I didn't type it into the chat as a question, but one of the things I think that's important to help people think about how to provide feedback is not just what questions do you have about this, but as you think about using these concepts, are they useful to you? So the debate you guys were just talking about, should it include the concept of government or not? You know, think about the intended purposes for this coded data, whether you're in research or you're in one of the community-based care providing organizations that's working on figuring out how to justify and capture learning about the value of the interventions that you're doing, or for risk adjustment or whatever. Just we're a large community with a lot of different stakeholders with different use cases for the information. Can you imagine the concepts as they're being laid out being useful to your purposes? And that's a good test. If they are, that's even, you know, positive feedback is another kind of feedback that's really valuable. And if you've got use cases where you're like, I'm struggling with how my use case would be supported by receiving data or having data coded in a way that we could access it like this, then that would be useful also to surface that use case where you're struggling to figure out how data coded in this way would work.
Okay, well, Lisa, I will hand this officially over to you, and thank you all for joining us today.
Can I just, I'm sorry, Donna, can I just bring up to the one comment that Caroline brought in the chat that I just want to make clear? So I had a typo, or we had a typo that I wanted to include. So the benefits data trust education, right, slide. So what needs to be understood, so part of what we did with this process, and I missed this and I apologize, is whenever someone submitted a name of a program that was private, like Benefit Data Trust, which is an enrollment program that states use to make sure that patients are actualizing all the benefits that they can have. We tried to generalize it to a term that would be applicable to any program so that we weren't building the most useful code. So we work with Benefits Data Trust to benefits enrollment assistance as the most generic name for their program, and a generic name that then could be applicable to any other organization that was doing the same thing. So that is the program name, and I missed that, so I'm sorry.
And Sarah, this is Linda. I made a note of that, so I'll fix it in the summary before we post that tomorrow.
Thanks, ladies. This is Evelyn. We do have one more question, and I do want to encourage the community. We're opening it up for questions. This is a really important topic, and we want to make sure we have good dialogue and discussion. We have many of you on the call today. Don't be shy. But let's address Rosie King's question. So it says, hello, we have an existing community health center vetted interventions or enabling services data collection framework with codes. One of the purposes is to use it for reimbursement. Thus, it includes info on time spent on service. Is the purpose of your interventions framework to use for reimbursement purposes as well? So who from the team wants to take that on?
Excuse me, John, you were dropping out. Could you say all that again a little closer to your mic, please?
Sure. I'm talking through my earbuds. The question, the comment is, I'll just sum it. They have a community health center vetted interventions or enabling services data collection framework with codes. One of the purposes is to use it for reimbursement. Thus, it includes info on time spent on service. Is the purpose of your interventions framework to use for reimbursement purposes as well?
Do you want me to try to take a stab? This is Sarah.
Yes, please.
Okay. So certainly the intent is to try and have reimbursable services documented as much as possible. We have not included just the time-based counseling codes that would be applicable for time spent counseling, but aren't specific to the concern of food insecurity. So what we, because you can apply them, you can do a Z59.4 and then do a counseling time code. And there are other time codes that happen as well. So generic codes we haven't included. Look at the interventions sheet when you're reviewing it, and it is quite large. There are many CPT in there, many CPT from the nutrition world, a lot of CPT from the care and case management world that we're developing. Any generic E&M code, or any generic counseling code we're not including at this time, but the ones that are specific to this concern we are including. And if you have any other ideas of other codes that should be included, please let us know. Oh, and I wanted to say one more thing. We also are including CPT for specific screening activities when they're relevant.
Rosie, this is Lisa. One of the things that your question brings up, and I mentioned it in the chat there, is a line between when is it more efficient to think about structural representation of the information as opposed to generating many different codes. And my comment about adding a structural element is something that we could consider and debate over whether there was more value in having a general data element concept that could be included. It could be a coded concept that's simply, in 15-minute increments or something like that, 3 or 4 codes that are time chunks. Or it could be an integer that is a count of the number of minutes. That might be too granular, but you can see that it might be more flexible to allow a structural component to hold that kind of concept of the number of minutes than it would be to go and add multiple codes over and over and over again for doing a particular intervention for 15 minutes or 30 minutes or 45 minutes or an hour. So that is one of the interplays that we start to get into when we think about the data element definition, where it might make more sense to consider structural possibilities where we can make complex data types as opposed to doing everything with pre-coordinated codes.
Thank you, Lisa and Sarah. Any other questions from the community? Or Rosie, if you have any that helped answer your question or anything additional you want to comment on. Okay, silence means we can continue. Thank you, Rosie. Thank you, everyone. So Lisa, I'm going to hand it now to you to move us forward with the FHIR IG development process.
Thank you, Evelyn. Thank you, everybody. Boy, you guys are quiet today. Quiet, quiet. I'm going to, next slide, please. I'm going to talk about 3 topics today as we spend some time and attention on thinking about our FHIR IG task. I thought I would throw in a little bit about the benefits associated with participating in this aspect of what we're doing. And then I'll talk a little bit about some planning information, just because scheduling for things and what's coming in the future is always an important part of what you get from this call. And finally, I'll show you some places where you can get more information about our FHIR IG work. Next slide. I imagine and acknowledge that there are probably some of you out there in the audience who are asking yourself, why do I need to know about this FHIR IG stuff? Why does Lisa continue to drag this large and largely non-technical audience into the details of FHIR IG creation? I'd like to start just by offering a couple of possible answers to this question that might not be readily obvious, or maybe to some of you they already are. These are already good reasons for being involved. First of all, I think as a community that while some of you might not be super technical, consider yourself a typical audience for a FHIR IG, you may be the ones who convey this information out to others in your organization or others in your community who would benefit from knowing that this work is going on and knowing a little bit more about it. So it might be that your role is to really be an information conduit out into the larger community. It could be that you work for an organization where you are responsible for knowing, for developers who are working on stuff like this, and you might want to know about this so that you can point your people in the right direction. So becoming a navigator of the space could be an important aspect of it. You might be engaged in some decision making about purchasing technology that might help your organization share social determinant of health information. So it could be that digging into these details is really about being more informed as a decision maker. One other point I thought of is that you guys might be working for organizations that could benefit from having access to information like this, stuff that you just don't have access to right now. And so understanding what the coded data will be could actually help you determine how this kind of information might be useful as an opportunity for your organization. And finally, for organizations that are involved with gathering and creating social determinant of health information, this detailed information that's in the FHIR IG is something that might give you a glimpse of what the future may hold. And in terms of SDOH information, it could be information about how your system will need to generate and share information in this new common standardized way. And so it might just be that these are the kinds of details that help you understand the emerging standards so that you can figure out how or compare it to how your system is currently operating and get yourself more of a roadmap to the future. So whether you're super technical, which obviously the FHIR IG is really important to you that way, or you have more of a business perspective or a care service providing perspective, I really do think that going on this journey of digging in deeper and understanding how all of your data element definition work plays out in the FHIR IG will be a worthwhile journey. So my promise is to make the information valuable to you. Next slide, please, Evelyn. In terms of planning, there are some things that are very well known and some things that are a little bit less well known coming up in the future. We know for sure that we want to have the Gravity community take a look at the narrative parts of the IG that we're building in that December to January timeframe that Lynette covered when she first went over the schedule at the beginning of this presentation. We have ported much of the use case work that was done at the beginning of the project into the IG so that it establishes the business case and the uses and use cases for the information. And so this would be material that you'd be familiar with already and is largely a narrative read. We will be asking for the community, the Gravity community, to help us with that over the holiday break and, tail end of December, early January. What is less well known is, or less understood exactly at this time, is this notion of being able to gather implementers together who would be willing to test some of the guidance that we're developing. We are thinking that there will be two opportunities between now and September, one of which in May, you see in the middle of that light gray swim lane, that we know for sure will be in San Antonio, Texas in May of 2020. And we know for sure that there will be a Connect-a-thon in Baltimore in September of 2020. But what we aren't sure about is when exactly that Q2 Connect-a-thon opportunity will take place. We were thinking it might be as early as February, but now it's not looking like that is going to happen. And so I just want to keep you on your toes that we are looking for another time and another place to gather the community for testing, and it may not happen in February. The last swim lane in the darker gray shows two additional opportunities for larger HL7 community feedback. That includes Gravity as an HL7 FHIR accelerator. We are part of the HL7 community now, but we also will be engaging other technical experts to be reviewing the IG for specific issues around vocabulary in May, and then for the full technical IG in the September ballot cycle, which really the review period happens in August and in the early part of September. So that's the key points in terms of milestones to be planning for. And if you are one of those conduit resources that's helping to engage and pass this information on to other more technical resources in your organization or in your community, then these red stars really represent some key points that you'll want to share with them time-wise. Next slide. In terms of finding information that's relevant and important to the FHIR IG work, there is a Confluence page within the Gravity space that is called the SDOH FHIR IG page. And if you go there and bookmark that spot, it is the starting point for all things FHIR IG related. And most important, at the very top of that page, there is a sign up link that you can click and provide some information about your contact name, your organization. If you have interest in participating in any of this Connect-a-thon testing, it's really helpful for us to have a list of who's thinking about it so that we can stay in close contact with you, because as you could see from my previous slide, things are always changing and materializing, and we want to be able to have a short list of folks who are really planning on engaging their organizations with us to do this kind of testing. So if you are, please go to that sign up link and make that known. Next slide. Lower down on that bookmarked page, there is an area that I've created just for people like me who have a hard time keeping track of all the many places that you need to go on Confluence to get at what you need and what you want to access. So this quick links table is what I use to remember all the links that I mostly need to go to stay on top of what's going on with the FHIR IG. The far left-hand column has two links that will take you in real time to the IGs that we are building as we publish them. The top one is the clinical care environment. This is where we're doing the majority of our work as we begin to lay down use cases and profiles and talk about the guidance for how data sharing would be done through the use of FHIR APIs. We write all of our work in there. And then for parts of the material that seems really relevant for more work than just the clinical care setting, we can anticipate there will be a collection of social determinant of health FHIR IGs. We've created this overarching technical framework guide where we can promote some of that content up to a higher level, and then it will be accessible for all the IGs and common to all the IGs that we'll be creating. And so there you can see things like some conventions that we've established for how we will name things, like our profiles and our value sets. The rest of this has access points into the HL7 work groups who sponsor our work. This is where we are most tightly coupled into the HL7 community through a work group called Patient Care, who is sponsoring this project, and our two co-sponsoring work groups, the Vocabulary Work Group and the Public Health Work Group. We keep track of our governance documents that are important to the overall management of the project within HL7, our project scope statement, and our IG proposal that are being approved within the governance structures at HL7. And then you'll see some spots that are not active links yet, but they will become them. As we know more and more information, the registration pages become available, the track programs become available, all of that, including reference implementations and testing tools, will materialize on this quick links page. So the bookmark that we talked about before, and then lower down on the page, quick links, I think this is the most useful spot to keep in mind. With that, Evelyn, I think I would like to just take my last 10 minutes to show folks around the Gravity space here for our IG. If you could pass me the presenter ball, please. Almost there, not quite yet.
So this is Lynette. I'm finding you in the list and it's not being friendly to me.
Yeah, Lynette, I'm having trouble. It doesn't allow me because she's down on the list.
Yeah, give me just a second. Let's see. Okay.
I am now the presenter. Terrific. Thank you very much. So this is that Gravity SDOH FHIR IG page that I suggested bookmarking. Again, to find your way here, once you're in Confluence, you click on that Spaces tab and go into the Gravity project. If you don't see that on your quick links, there is a space directory down here on the bottom that brings up all of the different Confluence spaces, and that's how you can find the Gravity project. But once you have that loaded, the page tree at the very top takes you to the Gravity SDOH FHIR IG page. And this is where you can sign up for Connectathon testing. That's an active link. It will take you to a form where you can type in your name and contact details. The project team that's working on the FHIR IG and doing the heavy lift of developing a lot of this material is listed on this page in case you need to be in contact with. And I'm losing my power on my phone. Hang on just one second, please. You can tell it's been a long day. You can tell it's been a long day when my handset is out of juice by about now. Okay. So this page, can everybody hear me still?
Yes, we can.
Okay, great, thanks. This page has got our key project deliverables and some of the milestones, which I marked in a nice, it's not quite a Gravity purple color, but a kind of a magenta color here. These are the things that as the Gravity community, you can look at these activities that will be coming down the pike, and they will eventually become hot links that take you to other areas to get more information about logistics and signing up, registration, tracks, etc. Here's that quick links area. So I was going to show you a little bit about some of the work that we already have built out on these IGs so that you can get familiar with what that looks and feels like. The last two times we have discussed and talked about what FHIR is, what FHIR IGs are. FHIR IGs are the place where FHIR profiles live and where guidance lives on how to use FHIR to share data. We use a tool called Trifolia on FHIR to build our IGs, and they all have a pretty similar look and feel to them. with some main navigation tabs across the top right here. And the profiles and extensions, the terminology, the capability statements, these are all more technical artifacts. But the main table of contents and this home page starts out with a volume of information that's more business case oriented and very readable. So don't be intimidated. Just think of it as a website that you're going to be exposed to the work that we've already developed. You will see information about how to read the guide, and some practical guidance eventually will be added for how to use it in different circumstances, some acknowledgments, and a lot of background about the project itself. This is all stuff that you would have been exposed to in our basic project charter for Gravity Project. The personas and patient stories you'll recognize from the work that we went through early on in defining some examples that we can use to envision the use of SDOH information in a particular use case. And then we have our use cases defined, the 3 that we've been talking about. Here they are. And as we click into these places, it gets to the more technical material that I've been showing you about actor transaction diagrams and some of the sequence diagrams for really understanding the information flows associated with those use cases. There'll be a summary of the actors, the system actors that are involved in each of these use cases up at this high level. And this information is important as you think about, how is this relevant to my organization? Where do our systems sharing information fit in? And what roles might we play in this standard framework that's being established? So the actor area, right now I've just filled this in for use case 1. For folks who are starting to think about Connect-a-thon, use case 1 is definitely in. We will likely have use case 3, and we're working on understanding when we will be able to take on use case 2 as well. So this first area is useful information for thinking about what actor your systems might play. And then we will begin to have some high-level, I'll call them Reader's Digest versions of describing the new SDOH FHIR profiles that we will be developing in this IG. You see here our food insecurity observation, potentially a food insecurity service request, and possibly a feedback response. We're not sure that we really need to create these yet. We're working with public health folks to assess another FHIR IG that has done some work in this area already, but we're still considering whether there might be some reuse and possibilities there. And the notion of reuse brings me to the next area of the IG, and this is where we have already determined that there are existing FHIR implementation guides that already provide for the community great guidance on how to use very basic resources like practitioner role, organization, location, patient, and even some of the cornerstone profiles that we'll be needing for our activities of care. The condition resource, this profile explains how to represent diagnoses, and a goal profile and a procedure profile that will largely be used for completed interventions, things where the activity has already taken place, as opposed to these profiles that are around planned or requested and ordered kinds of interventions. So this is where you would just generally, for folks that are interested at a higher level, this first page of the IG might be as deep as you go. But for folks who want to click deeper, these links take you into other FHIR IGs or into the work that we will be developing in our own implementation guide, so that you can understand at a deeper level how this guidance comes together. And
So
with
Lynette,
with that, I'm turn it over to you. Sorry, Lynette, I didn't mean to take up. Yep, I'll let you close.
That's quite all right. Evelyn, I'm going to throw the ball back to you so you can show the homework slide. I just wanted to make sure that everyone knows what's expected moving forward. Just remind you of some upcoming due dates. If you can review the summary files, those are screening, diagnosis, goal, and interventions, and those are the things that we've gone over in these end-to-end review calls. There are some rolling deadlines, but we will accept comments on all of these through November 7th if you are not able to get them in by the due dates that are shown. We had stipulated screening by October 24th, diagnosis and goals by October 31st, intervention by November 7th. But please do send us anything and everything that's on your mind by November 7th, and we will make sure that we consolidate your comments and address them. And then put on your calendar for the Connect-a-thon event in Q2 of 2020, and we will provide more information on that as our meetings move forward. Are there any last-minute questions? Oh, go ahead.
Sarah, I just wanted to add to that, part of like education is, that sometimes you present things and really critical questions come up later. And we do review so much content in these slides. So specifically regarding some of those questions with the concepts that we presented regarding the interventions, if anyone ever on the call ever wants to have a direct email exchange prior to submitting formal comments, we're open. If you feel like you need a phone call to better understand, I'm happy to reach out. We really want to make sure that everyone understands and feels engaged in the process. I'm not the person to talk about the FHIR IG. But anything else, so we just want to make sure that we feel like there's a real sense of engagement, and we do recognize so much is covered that sometimes you might need to process things and then formulate critical questions after the fact.
Yes, thank you, Sarah. And you can always reach out to us via email at gravityproject@emiadvisors.net. And I believe that's on the next slide. And with that, unless there are any last-minute thoughts or questions, I will open up the line for 5 seconds here.
Lynette, this is Evelyn. I just want to add that, piggyback on what Sarah said, if you're also new, this is your first time joining. I know we've had new members join us over the past week. Please reach out to us. We're happy to spend some time even navigating what we have to date, what we've developed. Going through Confluence, we try to streamline it as much as we can. It has a lot of information, and we appreciate that folks may need a tutorial when they first join us. So please don't hesitate to reach out to us, and we'll get back to you.
Thank you, Evelyn. And with that, we will go ahead and adjourn. We really appreciate you all being on today, and we will meet next week. Thank you all.
Thank you, everyone.